Welcome. This will be a brief overview of the Early Screening Inventory Revised 2008 edition, or the ESIR. The information presented here is from the publisher's manual. Pearson Early Learning is the publisher, and their websites are listed on the right-hand side. The bottom website will get you there more directly. I found their general site to be a bit overwhelming with many choices and directions to go. The authors of the ESIR are listed here. Dr. Meisels is the president of the Erickson Institute. He is on the faculty of the University of Michigan School of Education and is an emeritus board member of the 0 to 3 National Center for Infants, Toddlers, and Families. Laura Henderson and Dorothea Marsden are independent consultants. Martha Wisk is a lecturer at the Harvard Graduate School of Education. The ESIR has a long history. Originally, Meisels and Wisk adapted items from the Stanford-Binet Intelligence Scale, the Denver Developmental Screening Test, the Giselle Developmental Scales, and the Illinois Test of Psycholinguistic Abilities. In 1990, the screening was revised with 2 versions and is still in use today. The ESIR is a brief developmental screening that is individually administered. It samples domain tasks in 3 broad areas: visual motor adaptive, language and cognition, and gross motor. It is used to identify children from 3 years old to 5 years 11 months old who may need special education services in order to perform successfully in school. It is not performance-based. It does identify potential adverse learning conditions and is only one step towards a formal assessment process. So, using the test booklet, the materials pictured here, and additional blank paper supplied by the examiner, the screening can begin. As with other screenings and assessments, the manual stresses the importance of a comfortable setting and having a rapport with the child. Remember, some children taking this screening may be as young as 3, so rapport will be essential. Testing age needs to be established using the standard procedure, and depending on the 6-month interval for the ESI preschool, some items are not used. Tasks progress from easier to harder. The visual motor adaptive tasks include block building, drawing a person and 4 different shapes, and a visual memory game with the solid figured cards. These assess fine motor skills, eye-hand coordination, short-term visual and auditory memory, and the ability to reproduce 2- and 3-dimensional forms and structures. The examiner takes notes while the child performs these tasks. The language and cognition items focus on language comprehension and verbal expression, the ability to reason and count, and the ability to remember auditory sequences. Both open-ended descriptive expression and demonstration of conceptual and logical modes of thinking are called upon as the child answers questions about the ball, the button, the green block, and the car. Jumping, walking on a line, standing on one foot, and hopping comprise the gross motor portion. Speech and behavioral observations are recorded for all items. The screening takes approximately 15 minutes. The parent questionnaire portion provides pertinent background information as well as information on the social emotional aspects of the child. There is no scoring involved. The manual also suggests a full physical by the family health care provider as part of a complete developmental screening. The ESIR is relatively easy to administer, but because of the observations and judgments needed, it requires someone with a working knowledge of early childhood behavior and development, as well as assessment skills. And as with all screenings and assessments, following the manual protocol is mandatory. Pearson does provide 2 training videos on their website. The manual also provides 6 full examples of tests that have been taken for referral and discussion. 1, 2, or 0 points are scored for each item as pass, fail, or refuse. No points are scored for fail and refuse. 4 refusals in a row negate the instrument. Rescreening would then be advised within a few weeks, but if the child is at the lower age range, a wait of 6 months is advised, this to allow for further development. Results fall into 3 categories. Okay, meaning nothing further needs to be done. Rescreen, which means to test again in 6 to 8 weeks to make sure of the score, and refer, indicating further assessments are needed to use RTI to compile observations and gather more information for referral. The most recent normative sample in 2007 included 6,031 children with a variety of norming samples, and it matched the 2006 census statistics in this sampling. The ESIR is considered very reliable in the 3 categories listed, given the age ranges being screened. These results have been stable since the 1990s. The statistic that notes the 18% over-referral is considered acceptable because early intervention can have a large positive effect on development, so over-referrals are preferable to under-referrals. Also, consider that classroom observations and other information would be considered in deciding on further, more formal assessments. Predictive validity scores indicate that the screening does indeed identify the majority of children at risk for learning issues. Extensive info on both validity and reliability are found in the manual. As far as modifications and accommodations, the screening has few options. Although following the sequence is advised, if the examiner believes a child would be more comfortable starting at a different task, he or she may do that, but it must be noted on the score sheet. Some items are given a second trial if it appears that the child does not understand directions. There is an English and Spanish version only, and parents may be present, sitting behind the child's visual field if separation is an issue. Parents are asked not to speak, however. The manual does not specifically mention English language learners, but does state that test translations may not be valid without an equating study, which has been done for the Spanish version, and information on that process is also included in the manual. In deciding whether to use this instrument, one of course needs to consider many factors: purpose, validity, reliability, and the children using the instrument. It must be stressed that this is a screening instrument, not a skills assessment. It is a tool with a long history and with a regular evaluation process. Statistics on reliability and validity remain constant. Remember, children may be as young as 3, and developmental stages are variable at these ages. The manual itself is comprehensive, not only providing protocol, but including research statistics for different evolutions of the screening. The examples provided and rationales for scoring are clear and helpful. Score sheets are easy to use. Although the screening is brief, it does require knowledge of child behaviors and keen observation skills, both of which are necessary in the preschool classroom to begin with. I do feel that in this day and age, especially in more urban communities, the screening does not provide for English language learners in the variety of culture and languages that may be in attendance in a preschool program. One huge benefit, taking everything else into consideration, is that the cost per child is very affordable, a little over $5 per child. And accrediting bodies love this instrument because of the parenting piece. This review lists having 2 instruments as a limitation. I, however, see this as a benefit because at this age, 6 months to a year difference can show profound developmental changes in a child. Other examiner qualifications are also listed as limitations, but these also seem well advised when dealing with young children. I would highly recommend this screening for any preschool classroom. Thank you for your time.